Hello, my name is Wesley Gowers. I'm an NP student at Auburn University, and this is my final head-to-toe assessment video. Some things before we get started. My patient would normally be in a hospital gown. However, for purposes of the video, she's just in normal street clothing. And to protect modesty, some of the assessments will be verbalized instead of asking her to raise her shirt or remove any article of clothing. As well as on some of the organ systems, as in the eye and the ear, I'll only be doing the right, not the right and left. And also in every system assessed, I will go ahead and verbalize that I will be looking at the skin. I'll be checking for lesions, abnormal skin color, masses, nodules, any other abnormal findings. And if they are negative, I will just say normal skin findings. All right, before we began this video, I did wash my hands. I did check her vital signs, her weight, and her height, which are within normal limits except for our expected limits, except for her weight, which does fall into the category of obese, but she is pregnant. Will you please state your name?
Amanda.
All right, what year is it?
2021.
Well, who's the president?
Biden.
All right, and what are we about to do?
Our head-to-toe assessment.
All right, mentation status is present. She is oriented ×3. All right, now I'll begin with her head. I'm going to be looking for infestations, lesions, masses, any abnormal findings there. I will then palpate. Does that hurt?
No.
All right. No pain noted, no infestations. It is clear. All right, at this point, I'm going to go ahead and palpate her temporal mandibular joint. Go ahead and open your mouth. All right, no clicking or crepitus noted. I'm going to go ahead and look at her sinuses. We're going to have the maxillary. We're going to go ahead and do the frontal. All right, is there any pain there?
No.
No swelling noted. I'll percuss. No, absent. All right, checking her temporal pulses. 2+ inbounding bilaterally. Okay, I will now move to her eyes. I'm checking her eyelids. I'm checking her eyebrows. I'm checking for symmetry. The sclera is white. I can see the iris. I can see the pupil. Her pupils are 3 millimeters, which is a normal finding. Her conjunctiva is pink and moist. Her lacrimal duct is patent, and then her, all right, no edema noted in her eyelids. Okay, I'm going to go ahead and assess with the ophthalmoscope. What I'm going to be looking for here is the fundus, the macula. I'll be looking at the veins in her eyes. I'll be looking for the red light reflex and the optic disc. All right, if you'll just look straight ahead. All right. Okay. Okay. No hemorrhaging or narrowing of the veins noted. Optic disc was present, and the red light reflex was present as well. I'll now move to her nose. First, I'll inspect. It is midline. There is no edema noted. I'm going to palpate. All right, that is normal. I'll take my pen light. I'm going to be checking to make sure there's no foreign objects, that the nasal passage is clear, looking at her nasal turbinates. Septum is midline. It is clear, although the nasal turbinates are a little red and inflamed, but it is seasonal allergy season. There is some slight irritation. All right, I want to go ahead and check for patency. All right. Both sides of both nares are patent. Now, I want to go ahead, I'm going to look at the ear. I'm checking to see, I'm going to palpate. All right. Does that hurt? Pain is absent. I'll then go ahead and perform with the otoscope. I'm going to be looking for any kind of foreign objects. I'm going to be looking at the tympanic membrane to make sure that the canal is patent. All right, canal is patent, no foreign objects noticed. I did see the tympanic membrane, which is pearly and gray. There was a conolite, and part of the malleus bone was visualized. Okay, and I want to go ahead and check her mouth as well. The lips are pink and moist. Gums. Her gums are pink and moist. Her teeth are intact. Mucous membranes are pink and moist. Sublingual is pink and moist. Tongue is pink and moist. I am going to go ahead and look at the oropharynx. Okay. All right. It is pink and moist, and uvula does move midline. Okay. Excuse me. All right. Now I'm going to go ahead and start assessing her cranial nerves. So the very first one is her olfactory, which I'm going to get her to smell, and then she's going to tell me what she smells.
Cinnamon.
All right, cranial nerve 1 is intact. All right, for cranial nerve 2, I'm going to go ahead and check for pupil reactivity. Look straight ahead for me, please. And accommodation. All right, pupils are reactive. All right, part of cranial nerve 3, I'm going to go ahead, 2 and 3, reactive and accommodating. Go ahead and check 3 again. All right, her eyes do cross, which is a normal finding. Also want to go ahead and get her to check her vision using a Snellen chart. I'm going to hold it about 14 inches away from her face. I'm going to ask you to cover one of your eyes. Read the smallest line.
LTFPH.
Okay, cover the other eye.
LTFPH.
All right, now with both eyes.
LTFPH.
All right, her vision is 20/20, which is a normal finding. Okay. Excuse me. I'll now assess cranial nerve 3, 4, and 6 by assessing her extraocular movement. Just follow it with your eyes only, please. Okay. All right, cranial nerve 3, 4, and 6 are intact. All right, I want to go ahead and assess cranial nerve 7. I'm going to get you to raise your eyebrows, clench your eyes. All right, smile, frown, show your teeth, puff out your cheeks. All right, cranial nerve 7 is intact. And also, while I'm checking her cranial nerves, I'll just check her facial nerves. So I want you to go ahead and tell me, close your eyes and tell me if you feel anything dull or sharp. Okay.
Dull, dull, dull.
Okay.
Ooh, sharp, sharp, sharp.
Okay. Now keep your eyes closed. I'm gonna go ahead and assess. Tell me where I'm touching. Okay.
Left cheek, forehead, chin.
All right. Now I want to go ahead and assess cranial nerve 8. I will do that by a whisper test. Oh, excuse me.
1, 2, 3, 4.
All right, good job. Earlier I did assess cranial nerve 9. Her uvula did move midline and symmetrically. All right, I'll go ahead and assess cranial nerve 10, which is gag reflex. Sorry, my patient is pregnant. Okay, cranial nerve 10 intact. I will go ahead and assess cranial nerve 11. Okay. All right. Push up against my hands. Okay, good. Push up against my hand with your, rotate your head. Good job. Cranial nerve 11 is intact. And finally, cranial nerve 12. Take out your tongue. Okay, take your tongue. Okay, up, down, side to side, and then around. All right, good job. Cranial nerve 12 is intact. Okay, now we're going to go ahead and move to the neck. I do not see any abnormal findings on her skin. I'm going to go ahead and palpate. Is that painful?
No.
All right, pain is absent. I want to go ahead and palpate for her carotid arteries. All right. They are present, 2+ and bounding bilaterally. All right, excuse me. I'm going to go ahead and get my stethoscope. I want to listen to her carotid arteries. All right. No bruise noted. Okay, while we're on the neck, I want to go ahead and check range of motion. So if you would, put your head to the side, right, front and back, and then just do a circular motion. All right, full range of motion present. I'm now going to check her thyroid. I'm expecting to see if I can see her thyroid, and I cannot see that. I'm going to palpate. I don't feel it. Now I'll also get her to take a sip of water. All right, when I tell you to swallow, please. Okay, swallow. All right, thyroid was not felt, which is a normal finding. Sorry about that. Let me put the top on that for you. Okay, moving down to the shoulders. I'm checking the joints. No crepitus or pain noted. No swelling. Okay. Go ahead and check range of motion. I want you to go up, down, front, back, and then go ahead and roll the shoulders front and back. Okay, full range of motion present. I'm going to go ahead and move to her arms. Once again, checking the skin. No abnormal findings noted. No lesions, no masses. No abnormal discoloration. Checking for muscle mass. All right, which is as expected. Okay, I'm going to check her pulses. Two plus and bounding bilaterally. Brachial. 2+ and bounding bilaterally. I'm going to go ahead and check the elbow. Okay, no crepitus or swelling noted. Is that painful?
No.
Okay, come over here.
No.
Okay, good. All right, I'm going to go ahead and check range of motion with the elbow. So do what I do. Out, in, twist, twist. Okay, full range of motion present. I want to check your arm strength, please. Go ahead and pull against my hand, pull upwards. All right, I want you to push down. All right, arm strength 5 out of 5. Okay, I want to go ahead and check your hands. We'll just keep moving down. All right, no swelling of the joints noted. Capillary refill less than 3 seconds as expected. There's no clubbing of the nails present. Okay, I want you to go ahead and I want you to grip my hands. Good job. Okay, let go. I want you to fan your fingers out. Okay, keep me from doing it. Okay, now bring them in and push against my hand. Okay, hand strength. Go ahead and make a fist for me. All right, good job. And out. Okay, I'm gonna check. Okay, there you go. Coordination. All right, I also want you to take your pointer finger, touch your nose, and then touch my finger. Okay, do it twice. Thank you. Good job. Coordination present. All right, let's see. Let's go ahead and close your eyes for me, would you please? Okay, I want you to tell me what you feel.
A ring.
All right, good job. All right, also, tell me what you feel.
Number 3.
Number 3, correct. Good job. Okay. All right, let's go ahead. I want you to face the camera, please. I'm going to check your back. Now, I've already assessed your skin, and it is, there are no abnormal findings noted. I will now palpate her back. Thank you. Okay. Any pain?
No.
Good. All right. Okay. I'm sure she likes that, being pregnant. Okay. We're going to check for tactile firmness. So we're going to get you to say 99 every time you feel my hands touch your back, okay?
Okay. 99.
All right.
99.
Good job.
99.
Good job. Tactile firmness present and equal bilaterally. Excuse me. I'm going to go ahead and percuss. All right, resonant upon percussion. Oh, before I forget, go ahead and take a deep breath in. Okay. Equal bilaterally. Now I am assessing her rate and her rhythm, which are of expected findings, and they are regular rhythm. Okay, now I'm going to check for excursion and measure. So the first thing I want you to do is I want you to take a deep breath in and hold it, okay? All right? Deep breath in.
Deep breath and hold.
Deep breath and hold. Okay. Okay. All right, yes, exhale. All right, then I'm gonna go ahead and get you to take in a deep breath and then exhale and hold it.
Okay.
Okay, hold. Okay, I'll measure. All right. That is 3 centimeters, which is a normal finding. Okay, now I'm going to go ahead and auscultate her lung sounds. Breath in and out. Deep 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 breath in. Deep breath in and out. Deep breath in and out. Okay, good job. We can turn around now. I'm going to assess the anterior chest. Okay, so on some of these assessments, like auscultating and percussion, I'm not going to go all the way down, but I would do all 8 fields, just for modesty reasons. I'm not going to do that. I want to go ahead and assess her skin. No lesions, bumps, masses, or abnormal findings noted. Go ahead and palpate. Does that hurt?
No.
No? Okay, all right. Go ahead and percuss. All right, percussion is resonant in the front, or anteriorly and posteriorly. I do want to go ahead and do tactile primitus. Okay, say 99.
99.
Okay.
99.
All right, equal bilaterally there as well. Okay. All right, so I'm going to go ahead and start my cardiovascular exam. Okay, first I'm going to go ahead and palpate. Let's see, it is aortic, pulmonic, Erb's point. Now I would do the tricuspid at the 4th intercostal space. I'm going to go ahead and try to assess PMI here at the 5th intercostal space. All right, it is absent, but that is a normal finding. Now I'm going to go ahead and listen to her heart sounds. Oh, sorry, no heaves, thrills, or heaves or thrills noted at either. Okay, just breathe normal. Aortic, pulmonic, Erb's point. Tricuspid would be at the 4th intercostal space, and then I'm going to go ahead and check the 5th intercostal space. There we go. Okay, good job. All right, that's aortic, pulmonic, Erb's point. Tricuspid's at the 4th intercostal, and then could you lift your breast for me again? And then all right, no murmurs or bruits noted. I did hear S1 and S2, regular rate and rhythm. All right, before I forget, I want to go ahead and check our lymph nodes. So let's do preauricular, postauricular, occipital, all right, parotid. I'm going to do tonsillar. Okay, then I'm going to do submental, maxillary, anterior cervical chain, posterior cervical chain, and then we have our supraclavicular. All right, and then I also want to do while I'm doing this, I'll go ahead and do the epitrochlear. All right, on the side of your arms. All right, I did not feel any lymph nodes, which is an expected abnormal finding. Okay, itching?
Yeah.
Okay.
Yeah. Belly.
I understand. Okay, so since she is female, I would go ahead and talk to her about a self-breast exam, and I'd also perform one myself. But for modesty reasons, I'll just verbalize that at this time. So I would be checking for any discoloration. I'd also be looking for lack of smoothness, dimpling. I would do 360 on her breast, checking for any lumps, any abnormal feelings or sensations. I'd also check her areola for any discolorations, and I would be looking for any nipple discharge. When speaking to her about her self-breast exams, I'll tell her she needs to do that at least once a month, preferably after a hot shower. She would feel around the entirety of both breasts, putting light pressure, looking for any lumps or any kind of orange peel look dimpling on any point of her breast. Okay. All right. Stand up for me, please. All right. Part of the cranial nerve exam, I'm going to get her to cover her eye.
I don't know if you can be seen right there.
Okay. All right. Cover her eye. I will cover my left, she'll cover her right, and then I'm checking peripheral vision. So tell me when you can see it.
I can see it. See it. See it. See it.
Okay, all right. I'll cover your left and I'll cover my right. Same thing.
See it. See it. See it. See it.
All right, peripheral vision is intact. Okay. I'm going to get you to go ahead and lay down for me, please.
Okay.
We're not doing that yet. All right, so now that I have her laying down, get you to turn your head over your left shoulder. I'm looking for her jugular vein. There is slight distension. It is present. There's slight indentation, and that is to be expected. I already checked her carotid arteries. I will go ahead and auscultate her heart sounds again while she's lying down. Aortic, pulmonic, Herb's point. Her tricuspid will be at the fourth intercostal space. Apical. Okay, I'll go ahead and use the bell as well. Okay, tricuspid will be fourth intercostal, and then I'll go ahead and check for EMR. Okay. So once again, S1 and S2, no thrills or heaves, no bruits or murmurs, and regular rate and rhythm. Okay, now I'll go ahead and start my abdominal exam. Okay, I'm first gonna check. I'm looking for curvature. I'm looking for peristalsis, any kind of discoloration. I'm also looking for any masses. I'm also checking her belly button, which is midline. Okay, I'm gonna go ahead and I'm gonna auscultate first.
It's itching. Sorry.
Oh, excuse me. Okay, those are normal active bowel sounds present. Now I'll go ahead and listen to her aorta. Somebody's hungry. Splenic and inguinal. Or iliac, excuse me. Okay, no bruits noted. Set these down, excuse me. Okay, I'm now going to do some light palpation. I will not do too deep of palpation considering she was pregnant, but I am going to do light palpation. Okay, does this hurt?
No.
Does this hurt?
No.
Does that hurt?
No.
Okay, what about here? Okay.
No.
All right, we got a baby right there, huh?
Yeah.
Okay, all right. I'm also going to check, see if I can feel the aorta. Okay. Okay. Now I'm going to try and identify her organs. I'm going to get you to take in a deep breath, okay? And exhale. All right. Liver. Spleen. Okay. And of course we have the kidneys. Okay. All right. I did not feel any of the organs, and that is a normal and expected finding. Okay, now in this situation, I would also go ahead and assess the size of her liver, but for modesty reasons, I'm not going to perform it. I'm just going to go ahead and verbalize that. I would go ahead and percuss, starting at her midclavicular line on her right side until I heard dullness going down, and then dullness coming up, and then I'm looking for 7 to 8 centimeter size on her liver. All right, and then I need to percuss. Okay. All right, it is resonant. Dull, excuse me. Okay, you can go ahead and pull your hands up. Okay, now we go ahead and check her femoral pulses. Just on the right side. All right, 2+ and bounding bilaterally. I'll move down to the legs. I'm going to check her knees. All right, there's no edema noted. No, is it painful?
No.
No pain, no crepitus or swelling. I'm going to go ahead and check her popliteal.
You can pull my pants up if it's easier.
Okay. Popliteal. All right, 2+ and binding bilaterally. Can I go ahead and get you to, I do need to go ahead and check your range of motion on your hips. Okay, so go ahead and bring your legs up one at a time. Good, up, good. Okay, I want you to cross one leg over the other. Good, cross, good. Okay, then go ahead and come out and back in. Same over there, out and in. All right, full range of motion present in the hips. Oh, I didn't check her hips, that might help. Is that painful?
No.
All right, no swelling of the joint, no crepitus or popping noted. All right, go ahead and check the range of motion on your knees. Bend your knees up towards your body, good, and back down, and same with the other leg. All right, full range of motion on her knees. Now I'm continue working down to her feet. So I'm checking her legs. I'm checking for skin color. They're fine. There's one abnormal finding. She does have some varicose veins on her legs. Now I'm going to check her posterior tibial pulses, which are 2+ and bounding bilaterally, and go ahead and do her dorsalis pedis, which are 2+ and bounding as well. We're going to go ahead and do capillary refill, which is less than 3 seconds. Okay, I want you to flex your feet up, down, in, out, circular. All right, good job. Full range of motion there. I'm gonna go ahead and get you to, let me relocate.
Why don't you move the stool out of your way?
One minute. Okay, I'm gonna go ahead and get you to push against my hands. All right, lift up. All right, good job. Now, if you could close your eyes for me, you tell me where you feel me pressing, okay?
Left heel arch.
Good. Yeah, good job.
Left top foot.
Okay.
Right top foot.
Okay.
Right heel.
All right, good job. Okay. Oh, while we're here, just go ahead and check the Babinski. It is negative. Okay. Can you go ahead and stand up for me?
Yeah.
Give me a hand. only a few more things to check. I'm gonna get you to bend over. I'm gonna check your spine now. All right. It is midline. There is no curvature or scoliosis present. Does that hurt?
No.
All right. Good. Okay, I'm gonna check the flexion of your back, please. Go ahead and lean forward. Okay, lean back. Hyperextend. Good job. Side to side. Okay, now twist. All right. Full range of motion present in the back. All right, now I need to check your reflexes.
Okay.
Okay. Excuse me. All right, we're gonna check radio. Okay, so let's locate, and then I think we were. Okay. Check brachial and the tendon. Okay. Check elbow. Right tricep. Oh, that's probably gonna hurt me if you come out too hard. Okay, good job. All right, I want to check your legs here. Okay. Check your leg here.
My least favorite part. No, the gagging was the least
I
favorite.
got you. Okay. All right, check the Achilles. Okay. Okay. Good job. Now while I'm down here, I'm going to get you to go ahead. I want you to push against my hands. All right, I want you to pull. All right, good job. 5 out of 5 strength on their legs. Okay. Last but not least, I'll go ahead and watch you walk. Okay, we're going to move the stool. I want you to start at the table and I want you to walk to the window for me. I just want to normally just walk. All right, normal gait. Now on the way back, I want you to do it on your tippy toes. All right, and when you walk back to me, but this time do heel to toe. All right. Normal gait. Okay, and now I want to perform the Romberg. I just need you to put your feet together, arms to the side, close your eyes. All right, there's no swaying or movement. That is a normal Romberg exam. A few things that I missed. I did listen to her voice and articulation when assessing cranial nerves 5, 7, 10, and 12, which are all intact. Okay, let's see. Am I missing anything else? I'm thinking. Okay, all right. Well, I appreciate you, and this will complete my head-to-toe assessment.
You forgot mental.